Thanks so much for coming out this morning. Neurosarcoidosis can look a lot of different ways, and I think before we talk about the symptoms of neurosarcoidosis, it may help to understand the different parts of the nervous system that we try to examine when someone comes in with neurologic complaints. So the parts of the nervous system, just really simply, would be the central nervous system, which is the optic nerves, the brain, the spinal cord; the peripheral nervous system, which is the nerves after they leave the spinal cord, going all the way down to your fingers, your toes, controlling the muscles, and this actually includes the muscles as well. The autonomic nervous system, which controls your heart rate, controls your sweating, controls your temperature regulation, is responsible for, little tingly things in your fingers and your toes. Those are three, different parts of the nervous system. And, when we're looking at symptoms, as a neurologist, I try to put things in one basket or another because it leads me to what the possible diagnosis is. The tricky thing about sarcoidosis is that it can affect any part of the nervous system. So when someone comes in with symptoms, even if they're central nervous system or peripheral nervous system, sarcoid always has to be a consideration in the cause of those symptoms. So we'll walk through some of the symptoms of neurosarcoidosis in the different parts of the nervous system because the symptoms are very different and the treatment is actually very different depending on what part of the nervous system is involved. So, like I said, the symptoms of neurosarcoidosis can be anything. This picture, this one body, so many symptoms, actually came from a multiple sclerosis website. And why did I pick this? It's because many of the symptoms that you see up here that are listed for multiple sclerosis are also experienced by people with neurosarcoidosis. Neurosarcoid can affect any part of the nervous system and can produce any symptom that you can think of. Sometimes they're very specific symptoms like vision loss or vertigo or weakness in an arm or a leg, but sometimes they're more vague symptoms that other people can't see from the outside. So difficulty concentrating, memory problems, fatigue, bladder problems. So any neurologic symptom can occur with sarcoidosis, and they're very similar to other conditions like multiple sclerosis, like lupus, like fibromyalgia, which means that people with neurosarcoidosis typically go a long time before getting the right diagnosis. And everyone with neurosarcoidosis is different. So just like the patients with multiple sclerosis that I take care of, no two people with neurosarcoidosis look alike, either in their presentation or how they respond to medications. So the most common symptom of neurosarcoidosis that I see, and one of the hardest presentations to actually diagnose, would be cranial neuropathies. So these are the cranial nerves, the nerves that go to move your face, to control your talking, to control your vision, your sense of smell. These cranial nerves are frequently involved with sarcoidosis, but the presentation is often mistaken for some other disorder. So almost everyone in this room has heard of Bell's palsy. Well, Bell's palsy is actually a very common initial presentation of sarcoidosis, but it's usually not recognized as that. When people have cranial nerve involvement with sarcoidosis, it's like the cases of early pulmonary sarcoid that Dr. Ribeiro was talking about. Sometimes they get better without any treatment. So when you have a symptom that gets better without any treatment, a lot of times there's not any follow-up. People assume that you're okay and that it's not a serious condition. So the very first and most common symptoms of neurosarcoidosis are often either missed or they're misdiagnosed. Optic neuritis would be another example of that. So this is vision loss, this is pain with eye movement, this is color vision abnormalities. This is a very common presentation of neurosarcoid, but we also see it with MS, we see it with lupus, we see it with a variety of other neurologic conditions. Central nervous system sarcoidosis can present in any way that you can think of. It can present as seizures, so someone has their first seizure. Someone has a change in headache. Migraine headaches are common in the population in general. They're common in people who have sarcoidosis, but what should make you worry if you have sarcoidosis and you have headaches is that you have a change in your headache pattern. It's no longer that typical migraine that you've gotten used to over 5 or 10 years. Now your headache is all over your head. It's there when you wake up in the morning. It sometimes wakens you from sleep. Memory trouble would also be a common presentation of central nervous system sarcoidosis. Weakness, and the weakness can come from the brain, which is pictured here, or it can come from the spinal cord. Remember, the spinal cord is part of the central nervous system. So some people with sarcoidosis have a condition called myelitis, which is inflammation in the spinal cord itself. Some people who have central nervous system involvement involve a structure at the very center of the brain called the hypothalamus. The hypothalamus actually controls secretion of hormones, it controls regulation of body temperature, and when this structure is involved, people have difficulty controlling the salt level in their blood, they have difficulty controlling hormone levels like cortisol, which can cause a variety of symptoms and actually be life-threatening. The way that we diagnose central nervous system sarcoidosis is through imaging. So a CAT scan usually doesn't give us very much information about neurosarcoidosis. We need to go to an MRI, which is what I've shown you here. And the type of MRI specifically that we need to see is we need to see an MRI with contrast. An MRI without contrast only gives us a small picture of what's going on. Many times people who have central nervous system sarcoidosis have a normal MRI without contrast. But when we give the dye, like you see here, we see this enhancement pattern where you see these arrows are showing you a nodular enhancement pattern. We see little nodules, and if we were to take a biopsy of this, this is where we might see some of those granulomas that Dr. Ribeiro showed you. Neurosarcoidosis can involve the peripheral nervous system, so the long nerves after they've left the spinal cord. And the typical symptoms of this would be numbness, tingling, weakness, difficulty walking. This isn't the numbness and tingling that you might wake up with and you shake your arm out and it goes away after a few hours. This would be really persistent, and you can't think of something that would have caused it. The way that we diagnose this, or the first step in diagnosing neurosarcoidosis involving the peripheral nervous system, is not by taking pictures. Our MRI gives us no information whatsoever about sarcoid in the peripheral nervous system. We actually do electrical tests, like what I've shown you here. It kind of looks like a torture chamber, but it's really not a painful test to have done. It's uncomfortable, but shouldn't be painful in the right hands. So what they're showing you here is little electrodes. So these are usually sticky tabs that are placed on an arm or a leg. And then we stimulate one of the long nerves, and then we record how long it takes that signal to get from the point of stimulation to those electrodes. And this gives us a lot of information about how well those long nerves are working. Then we think about sarcoid involving the autonomic nervous system, which is the third part of the nervous system that I was telling you about. And this is an increasingly recognized form of neurosarcoidosis. This may actually be more common than central nervous system sarcoidosis or peripheral nervous system sarcoidosis. It is usually an unexplained burning pain in the feet and the legs, reduced temperature sensitivity, and this type of neurosarcoidosis is very difficult to diagnose. The current ways that we try to diagnose this, to look at these very small fiber nerves, would be to do a few studies. One is called a QSART, and I don't have a picture of that here, but it tries, the QSART stimulates sweating in specific parts of your body and records the amount of sweat that you're able to make in response to a stimulation. We can do a skin biopsy and under the microscope look at the numbers of small fiber nerves that are in that skin biopsy. Again, this shouldn't be a painful procedure. It's a little bit annoying to have a small piece of your skin taken and looked at underneath the microscope, but it shouldn't be painful. And then finally, we can do actually a different type of sweat test where you're coated in a powder that changes colors when you sweat, and we look for abnormalities in sweating like you see here. Those small fiber nerves control our ability to sweat and to respond to temperature. So if we see patterns like you see here, we know that something is not right with those small fiber nerves. So how common is neurosarcoidosis? And the honest answer is we really don't know. Isolated neurosarcoidosis, so someone coming in with no lung symptoms, no bone, no heart symptoms, isolated neurosarcoidosis is actually very uncommon. It's less than 5% of people who have sarcoidosis. However, neurosarcoidosis with systemic sarcoidosis is probably more common than we actually realize. So depending on what study you look at, you may see a range from 5 to 20%. We estimate, based on our experience at Cleveland Clinic, it's 15% or higher. So how do we know when someone has neurosarcoidosis? How can we be sure that that's the right answer and someone doesn't have multiple sclerosis, someone doesn't have myasthenia gravis, or a number of other neurologic symptoms that are neurologic disorders that can produce the same symptoms? So we have a way of classifying how good we are, how certain we are that this is neurosarcoid and not something else. So if we see a typical pattern of involvement with neurosarcoidosis and everything else has been ruled out, we've looked for those infections that Dr. Ribeiro talked to you about, we've looked for those toxic exposures, we've ruled all that out, then we feel pretty good about our diagnosis of neurosarcoidosis. It's better if we see the typical pattern of neurosarcoidosis, plus we can find a granuloma somewhere else in the body. So a granuloma in the lungs, in the spleen, in the lymph nodes, somewhere else. The best would be biopsy of nerve tissue showing granulomas. But honestly, we often don't have to go to the step. I tell people, I want you to keep every bit of brain and spinal cord you have. So if we can get the answer some other way, we're going to do that. So treatment of neurosarcoidosis is very similar to what Dr. Ribeiro told you about for systemic sarcoidosis. The difference is almost everyone with neurosarcoidosis needs to be on immune suppression. We very often have to use higher doses than what we would need to use for other manifestations of sarcoid. The reason for this is that your body has a tight barrier between the blood, where your medicines that you take in wind up. They wind up in your blood to get to other places in your body. There's a very tight barrier between the blood and your brain and your spinal cord. So in order for us to get medicine in your body to the area that surrounds your brain and your spinal cord, we very often have to use higher doses, and we have to use longer courses of treatment. So when I see someone with neurosarcoidosis, I'm usually going to one of those second or those third line medicines that Dr. Ribeiro talked to you about. I'm usually going to those very quickly compared to someone who has just lung involvement. The other thing that we know about neurosarcoidosis is just because we see that the MRI is getting better with treatment, it doesn't mean that someone's supposed to feel okay. And usually people don't feel they don't feel perfect. They don't feel back to normal just because we can see improvements on the MRI or we can see improvements on those nerve conduction studies. So we do a lot of symptom management. Sometimes it's a medication for bladder function. Sometimes it's a medicine for fatigue. We do a lot of symptom management to try to help people improve quality of life. Sometimes hormone replacement is needed. Even after we treat the neurosarcoidosis, if you have involvement in the center part of your brain, sometimes that just treatment of the neurosarcoid doesn't return that hormone system to normal. And then physical therapy and occupational therapy are very important. If you can imagine having weakness or difficulty with your balance, treatment with immune medicines doesn't restore the strength and doesn't restore the balance. It actually takes a lot of hard work with physical therapy and occupational therapy to get those things back. So as much as we know about neurosarcoidosis, as much as we've learned, there are still some knowledge gaps that we have. One of them is just the very basic question, well, how common is neurosarcoidosis really? So this has been an effort for us at the Cleveland Clinic as we've identified people who have more and more experience and interest in treating neurosarcoidosis. We're trying to answer this question better. How common is neurosarcoidosis really? And what predicts who will get neurosarcoidosis? At this point, we don't know. We want to be able to diagnose neurosarcoidosis better. I don't want to take a piece of anyone's brain or spinal cord to get the right answer. If there's some other way to answer with a biomarker, with a blood test, then that would be preferred to doing a biopsy. And then how can we follow neurosarcoidosis better? Sometimes MRIs don't give us the full picture of what's going on. They don't let us know that the neurosarcoid is completely under control. And then finally, we need to know if there are some medicines that work better for neurosarcoidosis than others. Based on experience here, we have an idea, but it would be ideal if we had some way of systematically evaluating one treatment against another. So just like Dr. Ribeiro said, save up your questions. I will be back this afternoon and we'll be happy to take any neurosarcoid questions at that time.